Hello, everybody. This is Dr. Wickham Simonds. This is Michelle Kennedy, nurse practitioner extraordinaire from Dr. Simonds Metabolics and Weight Loss. We're live in the Raleigh office today to do out of Falls of Deuce Road in 540. And we're doing the Ask Me Anything Facebook Live event. Today is the 12th of July.
It is already July 12th.
Of July.
I can't believe it. I don't know if anyone else
We're hoping,
can.
as always, and I'll say Mr. Producer is asking me to introduce myself. Well, we've been through that already. We went through the introduction, and
Yes. We are here as
we
usual.
changed the angle back here, so you see it's a little bit different than it was last week. So you kind of got changing everything around. Got off to a discombobulated start, if you will. All right, $25 gift card again today.
Yes, to Target. So we're going to ask you to do a couple things as usual. We're going to ask you to like this video and comment in the comment section, #SimonsAMA. So make sure you do those two things and you'll be entered in the Target gift card, and we will announce it at the end of the show.
Excellent. Excellent.
Yes, and thank you for everyone who is joining.
Yes.
We're happy
we
to have
really
you.
appreciate it. And many of you listen in every Monday, and you tell me about it when you come to the office, and it keeps you on track and thinking about the things you need to be thinking about to lose weight and to get healthy. And so we really appreciate your attendance, and it's a big deal to us.
And the questions that you submit.
Yeah.
I mean, this is what the show is for. So
Yeah.
any questions that you have, let us know. We compile them and then we address them. And you can even ask us questions live in the comment section if you choose to.
That's right.
So should we get started?
We should. Sandra from Raleigh.
How long have you been practicing in weight loss, and what got you into this field?
Yeah.
This is a really good question. Often we are talking about really important stuff, but it's about you, the patient. But I think it is something that a lot of patients are curious about. How did we end up here? Because this is pretty unique as far as a medical specialty. So how about you go ahead?
So 2004 is when I started this venture. So this being 2021, it's the 17th year.
Mm-hmm.
And so I've been doing this a little while. When I started, there wasn't really anybody to tell me how to do it.
Mm-hmm.
And so it's kind of been a venture. Now we got all kinds of cool stuff because, it's a background, Sandra. In 1970, 2 out of every 100 people in this country was overweight or obese. Today, it's 75%. Okay, so the medical community is kind of like the federal government in a way. They're big and they're slow to react to stuff. It takes a while for stuff to filter through. And so a lot of us have known that there's a problem for quite some time, but to get the medical community acting on that problem is like, getting a very, very large organization to do something nimbly. It's hard to do. Mm-hmm. So there's been a lot of good changes that are happening. And so obesity medicine is now a specialty, and there's a board certification process. And, Michelle and I have been part of an organization that helped create all of that sort of thing and generate fantastic continuing medical education for doctors and nurse practitioners and physicians assistants and nurses. And that all that field is growing. It's growing very fast. And we've kind of been right there along it for the whole ride.
It's been fun.
And, so we're it's like starting a new specialty and, figuring out what it's going to be like. I'm an emergency medicine doctor by training. And see, that specialty was established. So you go to a residency program, they teach you the stuff. It's the same everywhere. We're kind of establishing that whole thing as we speak. And the deal is it's, if I look where we were 10 years ago versus where we are now, it's really moving pretty quick. And the day's going to come when way more doctors do what I do and what Michelle does by necessity. I mean, we just can't afford to look the other way.
Yeah.
Imagine if that many people had cancer in this country. The outcry would be absolutely insane. And so the more and more this is becoming a problem, and the bigger chunk of our healthcare costs it's eating, the more attention is being focused on it. And something more aggressive will continue to have to be done. And that's going to bring in more medical practitioners off the sidelines and getting on board and being part of this game. So I got into this field because I thought there was a problem. I was experiencing it personally, but everyone I knew was too. And I just didn't think that going to commercial weight loss programs was the answer. It was a more complex medical problem. And out of conviction, I said, I can't just sit here and do nothing. I have to do something. And so that's kind of how I got going. Yeah.
Thanks. That's helpful, right? Because even the staff sometimes needs a reminder of how we got started as a practice, right? This is Dr. Simonds Metabolics and Weight Loss, and we've been open here in Raleigh for a little over 9 years,
Yeah,
right?
that's right. Yeah.
And so I started right at the beginning of that. So it's been a little over 9 years since I joined the practice. Prior to that, I was a registered nurse in a small community hospital up in Pennsylvania, working on a med surg floor, and knowing that I did not want to stay in acute care. I was helping people with things that I didn't feel like I could really fix. I could put a Band-Aid on it, they would leave. It's like a revolving door, and turn around and they'd come back for preventable type things. And weight was a big part of that. And I, at the time, had no idea that this specialty existed. But when I moved down to North Carolina, I was in search of my first job as a nurse practitioner. And I was very fortunate to stumble upon this practice. And once I learned about it, it was like, this is it. Preventative medicine at its best. I mean, the list of medical conditions that are improved with weight loss.
Yeah.
Hundreds of things that get better with weight loss.
That's correct.
So it just felt like, if you were to drill down and really pick one thing to focus on, this is the biggest bang for your buck.
Yeah.
And I just fell in love with it. I've been here for 9 years.
There's very little that doesn't get fixed when people really change what they're doing and start losing weight.
Absolutely. And I think when I first started too, there's something I heard probably at one of the conferences. I've been to 9 Obesity Medicine Association conferences, which is the organization that he was just talking about. And I think at the beginning, we're talking about there are 2 really, really rewarding things to do in medicine. And that's delivering babies, because that's very joyous, and helping people lose weight.
Right.
A lot of the other stuff, it's a lot of sadness. It's a lot of difficulty. It's a lot of, this is not a good prognosis, but in our case, we get to celebrate with our patients and be happy for them and help them through some of the harder times and get them to a place where they feel good. So I've just loved it. So I kind of stumbled into it. It's been 9 years, and I don't want to do anything else.
Yeah, that's right. All right. Thanks for joining us. Welcome, those of you who are just joining.
Susie, Barbara, and Bobby, thank you so much for joining us today. This is our Ask Me Anything live
event. We do it every other Tuesday.
Monday.
We
don't even know what day of the week it is.
I was just checking to make sure everybody is paying attention. Okay, everybody's alert here except me. And remember, $25 gift card to Target. Like the video, #SimonsAMA in the comments. I think that was like a Freudian slip, thinking we ought never to have to work Mondays. We already are closed on Friday. That's right. Just FYI. I want a 4-day weekend every weekend. I wouldn't mind it. I think our patients would, though. So don't worry, we're not really going to move to that. Well, I know a lot of you don't like weighing Monday after the weekend anyway, because of the dietary indiscretion you sometimes practice on the weekends. Right. So we can solve it. Just be open Tuesday, Wednesday, Thursday. And Tuesday is a Tasty Keto Tuesday. Keto even though today is not the day you will get that email, there will be a wonderful email tomorrow. And this is some good stuff. We have great email content, and I hope more of you will open those and read them. Yes. Because it's just good stuff. It is. That's really good stuff. And if that's going into your spam, make sure you add us as a contact, and that way it'll get to your inbox. Yeah. All right. So moving on. Mara from Durham. I'm currently taking phentermine for an appetite suppressant, and I love how it works. I do at times get a bit of brain fog at midday. Is this normal, or should I be doing something to combat it? I like this question. Yeah, I like this question too. Okay, so here's the deal. The phentermine is a sustained release preparation, and so imagine these particles of phentermine of different sizes, and they absorb at different rates. And this is what makes it extended release. So big particles take longer to absorb. Very small particles absorb right away. And so if you make the particle sizes different sizes, they're going to absorb at different times. Okay.
And we're back. Sorry, folks.
I think we're back. So Mara from Durham, look, I don't know how much of my answer you heard before we lost the feed, but look, the phentermine is an extended release product that absorbs at different rates because the particle sizes that are in that pill vary. Mm-hmm. Smaller particles absorb faster, bigger particles slower, and in theory, it's a nice even absorption throughout the day, right? Sometimes, however, you metabolize particle sizes a little faster than other people do, and then there is a gap of time where you're waiting for the next particle size to absorb. And this, you feel like there's a brain fog, you may be tired, you may become hungry all of a sudden. This lasts an hour, hour and a half, 90 minutes, something like that, and then it begins to work again, and that's what's going on. So what I tell people is break the pill in half, take a half in the morning and a half again an hour before lunch, and usually that solves your problem.
Yes. Remember, medication phentermine always taken on an empty stomach, and for most people, this is not an issue. So this is not a really common thing, but when it does happen, we have ways to remedy it, like splitting up the medication. We also want to consider, because phentermine is an appetite suppressant, it helps us eat less, and a lot of patients will reduce carbohydrates. Sometimes brain fog may also be related to a drop in electrolytes or getting into a state of ketosis, right? The keto flu, where some people will experience a little brain fog or muscle fatigue or headache. So that's also something we are going to want to make sure isn't happening, making sure you're getting your water in, you're getting your electrolytes, and you're taking your medication appropriately based on what your symptoms are or needs are and
that's right.
Reaction is. So that's a really good question.
All right, John from Durham. John's a big fan of CBD. I like this question.
Yes.
He's overwhelmed by all the tincture varieties. It makes sense. Are there significant differences when one is marketed for better sleep versus more muscle recovery? Yes, there are some differences. So I brought some of first of all, we carry what I consider to be the leader, the best brand there is, and that is Naternal, Naternal, right here from Research Triangle Park. We know every step of the process from seed to oil, and we know the owner and all the folks that work there. It's a fantastic organization. They're doing it right. They rigorously test it and have it independently tested at every step of the process so that you're getting exactly what they say. It is in accordance with every federal and state law. There's no laws being broken with this sort of thing. And this is the highest quality product that's available. So the way to think about it is this. You have a full spectrum hemp oil, or CBD oil, we call it, and that comes in full and broad spectrum. So I brought an example here of the full spectrum, okay? So this is the full spectrum, and that's just, if you take the hemp plant, take all the oils that are in there, there's 119 of them that fall into this category of cannabinoids, so we call that CBD oil. You get all 119 that are naturally blended the way the plant grows. What we know, though, okay, from science now, is that certain of those oils are responsible for different medicinal properties, okay? And so what's taking place, I call this, we're now getting into what's called boutique cannabinoids. That is, we're taking the full spectrum oil, okay, and then we're adding in some additional of one of the 119 oils that's responsible for some medicinal effect. So the one for sleep, Naternal calls it rest. It's that same oil I just showed you, the full spectrum CBD essentially, and they add in some extra CBN. That's one of the 119 cannabinoids, and this is the one that's responsible for helping you settle down and sleep better. Okay, so it can be used two ways. It can be used, say, half hour before you go to bed, and but I use this, man, I can go to sleep, and if I wake up, say to urinate or whatever, I can go back to sleep right away, and then I feel like I've rested. The quality of sleep is way better, and I feel way more rested. This could also be used if you're the kind of person that's really amped up, and you get in a situation frequently where you're just kind of wired up. So you could take this before that, and this would help you settle down. So it can be used for more than just sleep. And then the muscle recovery you mentioned. So Eternal also makes what they call Move. It's the same concept. It's the full spectrum CBD. They just add in some extra CBG. That's another one of the 119 cannabinoids. This is the most potent anti-inflammatory. Okay, so I use this because I don't like taking over-the-counter NSAIDs like ibuprofen or naproxen. I mean, these things really irritate my stomach and give me a bad case of heartburn. I don't like those things. Plus, I'm an ER doctor, and I've seen cases of renal failure and heart failure brought on by those things. And I just don't want that sort of thing. GI bleed, that sort of thing. You won't get that with this. And so last night, for example, I took some of both. I took a dropper of both because I was sore from doing some workouts over the weekend. And 53 sometimes. I think like I'm 25 or 30, tend to overdo it. My body's telling me this stuff, by 10 o'clock at night. So I just take some of both. And, I felt so much better this morning, got up and worked out, and I was fine. So that's the deal. I embrace the idea of these boutique cannabinoids because I think that they really, really work. I think the full spectrum works great for a lot of different things. But if you're wishing to target your sleep or pain and inflammation, I like these two products. And if you want to ever get these, we got perfect pricing on them right here at our practice.
Yeah. And if you have questions, come and see us. We can help you determine maybe which one would make more sense. And the thing that a lot of folks do, they'll do maybe a different one in the morning and then the rest one at night. So you can even do them very safely in combination.
We've been using this stuff here in the practice for over a year. The patients love it. We sell a lot of it. The stuff really works and it's safe. It works and it's safe and it's natural. You're not going to get high. You're not going to turn drug test positive, all this other sort of thing. I shouldn't say if you're aggressively drug tested, I would suggest doing the broad spectrum instead of the full spectrum. Yeah. But that's kind of a minor point. You're not going to get high. You're not going to be inebriated because you use these things. It's not going to make you act wacky or anything like that. No psychedelic properties. No, they just work really, really well. And you don't really know how it's going to work for you until you try it. I know a lot of people say, well, so-and-so responded this way and responded this, but we don't really know how it's going to work for you until you try. So give us a call. Give us a call. Thank you for that question. It's good question, really John. So Tilly from Cary. Tilly. I got this one. I've heard your practice is more affordable and that you don't have contracts. Is that true? What else makes you different than those that do require contracts? So this is true about the no contract for sure. And we get reports a lot about the affordability being very different than nationwide practices and practices in the area. Now, I will say before we get more into it, there is not a competition within our medical specialty, okay? We are a business, but we are in the business of medical treatment. And we want patients to get the best care that fits them and what their needs are, no matter where it is. So if a patient, comes to us and ends up somewhere else, that's okay. If a patient goes somewhere else and ends up with us, that's okay too, right? So you're never going to find us saying like ours is the only place and every other place is, no bad talking, okay? If you find what fits for you, awesome. But where we practice, there are no contracts. There is no obligation of buying any kind of prepackaged food or supplements. Everyone is treated as an individual person with individual needs. And your treatment plan will likely not look anything like the person right before you or right after you that is seen. So that's important to keep in mind. As far as affordability goes, we are very upfront with our pricing. You can find that on our website. We talk about it in the office. We have it posted in the office. So our initial visit, we do require a deposit of $50. And then when you get here, you pay $150 because the total is $200, but we apply that deposit. Okay, so that's for a new patient. You only pay that once and never again. And then for follow-up visits, the cost is $75. And if you get medications, because we have an on-site pharmacy, that is additional. But the average cost of medications per month is like $30 to $40. That's right. So that's right. So we're pretty straightforward about it. And I just conceptually, I had to make that decision. Hey, signing contracts, all that sort of thing. And Michelle makes a good point. We're a medical practice. Do you go to your doctor for hypertension and they make you sign a contract
Right.
because you got hypertension. No, we're not in that business. Okay. That's something else entirely. And maybe that's a way to get people to be more compliant, but I'd rather just have an honest relationship with you. And we work on this thing together. In the end, the finish line's the grave. It's not some short period of time, a 9-week contract, a 12-week contract. You live in the United States, and with our obesogenic environment and food supply, this is going to be an ongoing problem. This is a chronic illness, and it needs management over the long term. And we want you to come to us because you want to come and help yourself, and we're not ever going to judge you. Those places with the contracts and stuff tend to really make you feel guilty that you're not meeting some particular standard. And I'm not into that stuff.
Right.
I'm not into that stuff at all. I'm here to help people,
Yeah.
not to make them feel bad about a medical condition. So anyway, that's who we are.
Yeah. And once a patient, always a patient.
Yeah.
What's your longest patient? Because I've had people
Yeah.
I've seen since day one, so
Yeah.
9 years that we've had a relationship.
I've got people now that came in the very first month when we opened up back in 2007 in the Durham office.
Yeah.
And so that they're still coming.
Yeah.
Yeah.
And that's something to celebrate. You know,
Yeah.
I think a lot of patients, when they return after being away for a bit, they come with some guilt or some shame. You know, I wish I wouldn't have had to come back. And we say, no, you should be so proud of yourself for just being here, because like Dr. Simonds just said, this is a never ending thing. And so there's always going to be, for us, once you establish treatment available, support, encouragement, prescription medication and treatment plans. And it's not a shameful thing. It's you practicing good self-care to say, hey, I need a little bit more help. I'm going to go ahead and go see my friends who I know can help me.
Yeah, that's right.
And we really pride ourselves in that kind of atmosphere here at the practice.
Okay, Melissa from Raleigh. Been doing keto for years. Can't tell if it's really effective anymore. I maintain my weight, but other than that, is there a good way to test it to see if I'm still seeing the benefits? What do you think about that, Michelle?
So I think that this is a really common issue. A lot of us will get to a point weight-wise where we're able to maintain, and a ketogenic diet is a really great way to lose weight, and also a really fantastic way to keep that weight from coming back. And often I try to talk to folks about non-scale victories that they may be achieving. So even if they're maintaining their weight, are you feeling energized? Are you sleeping well? Are you feeling in control of your food? Is your appetite and your cravings well controlled? You know, are you more focused? Is your mood better? I mean, there's so many things that we refer to as non-scale victories that we have to take into account. So I would say, you know, if you are still feeling good, Melissa, even if you're maintaining your weight, that is already a really, really good sign. As far as the testing goes, that's a little bit more complicated, right? So there are the three ketones that can be tested for. The most common that people do is the urine dipsticks, right?
That's right.
And I don't recommend them a ton. How about you?
No, I don't either. Not at that point. The bottom line is if you're under, 30 to 50 grams of gross carbs a day, you'll be in ketosis. I think the other thing, the way you ought to think about testing is, look, what does that lipid panel look like? What does that hemoglobin A1C look like? What does that fasting blood sugar look like? Those are the things that get better with this, that blood pressure. Those are the things you should think about.
Yeah.
And if you're getting any sort of physical activity and you've been maintaining the diet, like you say, those things will be markedly better than the day you started, and will be signs that your body is not inflamed and in good health.
Yeah.
And that's kind of the point of the whole thing.
Yeah. Absolutely.
Okay.
Oh, Denise, thank you.
Yes. Okay.
Denise says y'all are the best.
She a question about metformin. Is it better to take 2 tablets once, or is it better to split them up and take them breakfast and I think breakfast and bedtime? I actually like the latter strategy, even though it's technically an extended release. I pointed out just in the case of the phentermine question, which we had from Amara in Durham, is that you can metabolize these things at different rates. Some people just metabolize them faster than others. Therefore, if you can remember to split it and take it 1 in the morning, 1 in the evening, that's, in my opinion, better.
Yeah, and that's a caveat. If you can remember, if it is a struggle, the better thing is to take it at the same time. Yeah, take it at the same time, just so you get the therapeutic dose in that you're being prescribed. But if you can split it, go for it.
Oh, we got a
Got a
winner.
winner.
Winner, chicken dinner. Justin Warren, you're the winner.
Yay!
You are the winner of the Target gift card today. Thanks for attending and throwing your name in the hat.
Yeah.
Liking us.
We will contact you.
That's right. We'll get in touch with you, get you your
Yeah.
card.
Winner, keto dinner.
Winner, keto dinner. That's
The
right.
producer said. Yes, absolutely true.
Okay.
So thank you for everyone who did the hashtag Simonds AMA and submitted for the gift card. Thanks for watching. We're open here in Raleigh on Falls and News as well as in Durham at South
We are.
Point. Give us a call, and we'll see you in 2 weeks.
Okay.
Right? No
Sounds
holidays.
like a plan.
2 Mondays
That's
from
right.
now. All
2
right.
Mondays from now, we'll see you. Take care, everybody.
Have a good week.